The woman coded at 2:47 a.m. on a Tuesday. Not from a heart attack, not from a stroke, from her medications. 6 prescriptions, all legal, all necessary, all prescribed by different doctors who never spoke to each other. And when we finally brought her back, the first thing her daughter said was, "But she takes everything exactly as directed." That sentence haunts me because it reveals something most people never realize. After 60, your body processes medications differently than it did at 40. Your liver slows down. Your kidneys work at 60% capacity. Your stomach lining thins. The same drug combinations that were safe for decades can suddenly become lethal. And nobody tells you when you cross that invisible line. I am going to show you 6 medication combinations that are killing people over 60 right now. Not because the drugs are bad, because the combinations create reactions your aging body cannot handle. And I am going to tell you exactly what to do about it before your next dose. Stay with me. I have been a cardiothoracic surgeon for 32 years. I have performed over 2,400 open heart surgeries. I have held beating hearts in my hands and felt them stop when medications failed. I have watched families wait in surgical lounges while we try to reverse drug interactions that should never have happened. And the pattern I see is always the same. Multiple specialists, multiple prescriptions, zero coordination. The cardiologist prescribes blood thinners. The orthopedist adds pain medication. The primary care doctor continues the antacid. And nobody asks what happens when they meet inside your 60-year-old body. The medical system is built for treatment, not communication. Each specialist sees one problem, writes one prescription, moves to the next patient. They assume someone else is checking for interactions, but that someone is supposed to be you. And how would you know what to check for when medical school takes 4 years to teach this? Here is what nobody tells you. After 60, your body is not just older. It is fundamentally different at the chemical level. Your liver enzymes change. Your kidney filtration drops. Your stomach acid decreases. Your blood-brain barrier weakens. These are not diseases. They are normal aging. But they turn safe medications into dangerous combinations. Think of your liver like an oil filter in a car. At 30, it is new. At 60, it has processed 60 years of everything you have ever swallowed. It still works, but slower. When you take multiple medications, they queue up waiting to be processed. And while they wait, they interact with each other in ways the pharmaceutical trials never tested. Because drug trials test one medication at a time on healthy 35-year-olds. Not 6 medications at once on a 68-year-old with 3 chronic conditions. One study tracked 3,000 people over 65 taking 5 or more medications. 47% experienced an adverse drug event within 2 years. Adverse does not mean upset stomach. It means hospitalization. It means falls. It means bleeding that will not stop. It means confusion, so severe families think it is dementia when it is actually drug toxicity. And the tragedy is that most of these events are completely preventable once you know what to look for. Let me show you the 6 combinations. First combination, blood thinners and NSAIDs. You are taking warfarin or Eliquis or Xarelto for atrial fibrillation. Your knee hurts. You take ibuprofen or naproxen. Seems harmless. Here is what actually happens. Blood thinners prevent clots by blocking clotting factors in your blood. NSAIDs block an enzyme called COX-1 that protects your stomach lining and helps platelets stick together. When you combine them, you get blood that will not clot and a stomach lining that bleeds easily. After 60, your stomach lining is already thinner. Your kidney function is already reduced. This combination does not just increase bleeding risk. It creates bleeding that your aging body cannot stop. I operated on a 64-year-old man last year, aortic valve replacement. Recovery was perfect. He went home on warfarin to prevent clots around the new valve. 3 weeks later, his back started hurting from sleeping in a recliner. He took a Lev for 5 days. On day 6, he vomited blood. By the time he reached the ER, his hemoglobin was half of what it should be. We transfused 6 units. He survived, but his kidneys took damage from the bleeding that they will never fully recover from. Here is what makes this dangerous for you specifically. After 60, you do not feel pain the same way. Younger people get stomach pain as a warning sign. Your nerve sensitivity decreases with age. You can have a bleeding ulcer and feel nothing until you are vomiting blood. The combination is hurting you before you know it is happening. Write this down. If you are on any blood thinner, you cannot take ibuprofen, naproxen, Aleve, Advil, or Motrin. Not even for 3 days, not even the small dose. Instead, use acetaminophen. Tylenol. It does not affect clotting. It does not damage stomach lining. Maximum 3,000 milligrams per day. That is 6 extra strength tablets spread across 24 hours. And check with your doctor if you take it for more than 10 days. Second combination, ACE inhibitors and potassium supplements. You are on lisinopril or enalapril for high blood pressure. Your doctor mentions your potassium is slightly low. You start taking a supplement or eating extra bananas. Standard advice. Here's the problem. ACE inhibitors lower blood pressure by relaxing blood vessels, but they also tell your kidneys to hold on to potassium instead of excreting it in urine. This is intentional. It is part of how the medication protects your heart. When you add supplemental potassium on top of that, your blood potassium rises. After 60, your kidneys cannot correct this as quickly as they used to. High potassium does not cause pain. It does not cause fatigue. It causes your heart rhythm to destabilize, and the first symptom can be sudden cardiac arrest. I had a patient, 67-year-old woman, controlled blood pressure on lisinopril for 8 years. She read an article about potassium-rich foods being heart healthy. She started drinking coconut water every morning, eating a banana with breakfast, and taking a 99-milligram potassium supplement. 3 weeks later, she felt fine. Her potassium level was 6.2. Normal is 3, 5 to 5. At 6.2, your heart is one electrical impulse away from stopping. She had no symptoms. Her routine blood work caught it by accident. Here is what most people miss. Potassium does not just come from supplements. It is in salt substitutes. Morton Light Salt, New Salt, Mrs. Dash. It is in protein shakes, muscle milk, and sure, it is in energy drinks and coconut water and tomato juice. You think you are being healthy, and you are actually creating a lethal combination with your blood pressure medication. And if you take ibuprofen on top of lisinopril, you multiply the risk, because NSAIDs also make your kidneys hold potassium. Now, you have 3 things pushing potassium up and kidneys that are 60% slower at clearing it. This is how people on perfectly prescribed medications end up in the ICU. If you are on any ACE inhibitor, lisinopril, enalapril, ramipril, benazepril, avoid potassium supplements completely unless your doctor specifically prescribed them with monitoring. Avoid salt substitutes. Limit high potassium foods to 1 serving per day. And if you take any NSAID for more than 2 days, get your potassium checked within a week. I am going to tell you about the third combination in a moment. But first, I need you to understand something. Every case I am describing is real. These are not theoretical risks. These are patients I have treated, families I have stood with in waiting rooms. And the reason I am telling you this is because the medical system will not. Your cardiologist assumes your primary care doctor is checking. Your primary care doctor assumes the pharmacist is checking. The pharmacist assumes you know, and you have no way of knowing because nobody taught you. Third combination, statins and certain antibiotics. You are on atorvastatin or simvastatin for cholesterol. You get a sinus infection. Your doctor prescribes clarithromycin or erythromycin, common antibiotics used for decades. Here is what happens when they meet your statin inside your 60-year-old liver. Statins are processed by an enzyme system in your liver called CYP3A4. Clarithromycin and erythromycin block that exact enzyme system. When the enzyme is blocked, your statin level skyrockets, not by 10%, by 400 to 800%. At that concentration, statins break down muscle tissue. After 60, you have less muscle mass to begin with. You are more vulnerable. The breakdown releases a protein called myoglobin into your blood. Myoglobin clogs your kidney filters. Your kidneys fail. And this can happen in 5 days. A 71-year-old man came to me with chest tightness. We did an angiogram, moderate blockage. Started him on atorvastatin 40 milligrams. 2 months later, he got pneumonia. His pulmonologist prescribed azithromycin first. It did not work. Switched to clarithromycin. Day 4 on clarithromycin, his urine turned dark brown. Day 5, his legs were so weak he could not stand. His creatinine kinase, a marker of muscle breakdown, was 47,000. Normal is under 200. We stopped everything, hydrated him aggressively. His kidneys recovered, but it took 6 weeks, and it never had to happen. Here is why this matters for you. After 60, you get infections more often. Your immune system is not as strong. Doctors prescribe antibiotics more frequently. And nobody thinks to check if that antibiotic blocks the same liver pathway as your cholesterol medication. The interaction is well documented. It is in the prescribing information. But it requires someone to actually check. And in a 7-minute appointment, that does not happen. Write that down. If you are on atorvastatin, simvastatin, or lovastatin, you cannot take clarithromycin or erythromycin. If you need an antibiotic for respiratory infection, ask for azithromycin or doxycycline. They do not block the same pathway. And if any doctor prescribes clarithromycin while you are on a statin, ask them specifically if they checked for the interaction. Most of the time, they did not, and your question will make them look. Fourth combination, aspirin and anticoagulants with antacids. You are on aspirin for heart protection, maybe also apixaban for atrial fibrillation, and you take omeprazole or esomeprazole because those medications irritate your stomach. Logical. The problem is that proton pump inhibitors like omeprazole do not just reduce stomach acid. They change how your body absorbs and activates other medications. Aspirin and anticoagulants work partly because your stomach acid keeps your blood slightly acidic. That acidity affects how clotting factors function. When you neutralize stomach acid with a PPI, you alter that balance. More importantly, PPIs reduce magnesium absorption. After 60, you are already absorbing less magnesium because your stomach acid is naturally lower. Magnesium keeps your heart rhythm stable. When it drops too low, you get atrial fibrillation, which is the exact condition you are trying to prevent. I had a 69-year-old woman with well-controlled AFib on apixaban. She developed reflux, started omeprazole 40 milligrams daily. 6 months later, her AFib became harder to control. We checked her magnesium. It was 1.3. Normal is 1.7 to 2. We supplemented magnesium and switched her to famotidine instead of omeprazole. Her rhythm stabilized within 3 weeks. But here is the deeper issue. PPIs also increase your risk of fractures. They decrease calcium absorption. After 60, you are already losing bone density. Women especially. You take the PPI to protect your stomach from aspirin. The PPI weakens your bones. You fall. You break your hip. And because you are on blood thinners, the surgical site bleeds more than it should. One medication to prevent one problem creates 3 new problems. This is the cascade nobody warns you about. If you are on aspirin or any anticoagulant and you need stomach protection, use famotidine or ranitidine instead of omeprazole. They reduce acid without blocking nutrient absorption. Take 20 milligrams twice a day and supplement magnesium glycinate 400 milligrams at night. Check your magnesium level every 6 months, not just during routine blood work. You have to ask for it specifically. 5th combination, antidepressants and tramadol. You are on sertraline or escitalopram or fluoxetine for depression or anxiety. Your back hurts. Your doctor prescribes tramadol because it is supposed to be safer than opioids. Here is what actually happens. Both SSRIs and tramadol increase serotonin in your brain. That is how they work. But after 60, the barrier that protects your brain from excess serotonin weakens. When you combine them, serotonin accumulates. You develop serotonin syndrome. Early symptoms look like the flu. Sweating, nausea, confusion. By the time you realize it is not the flu, your temperature is 104, your muscles are rigid, and your blood pressure is swinging wildly. It is a medical emergency, and it can develop in 24 hours. A 66-year-old man came through our ER last winter, on escitalopram for 5 years, fell on ice, fractured 2 ribs, urgent care prescribed tramadol. Day 2, he felt feverish. Day 3, his wife noticed he was confused, could not remember what day it was. She brought him in. His temperature was 103.6. Muscle rigidity in his legs. We stopped both medications, gave him cyproheptadine to block serotonin, cooled him down. He recovered, but he lost 4 days to delirium that he does not remember. Here is what makes this particularly dangerous. Doctors prescribe tramadol because it is not a controlled substance like oxycodone. It seems safer. But tramadol is an SNRI, a serotonin and norepinephrine reuptake inhibitor, just like your antidepressant. You are essentially doubling your serotonin medication without realizing it. And after 60, your brain is more sensitive to that excess. If you are on any SSRI or SNRI and you need pain relief, avoid tramadol completely. Use acetaminophen first. If you need something stronger, ask for a short course of low-dose oxycodone instead. Yes, it is a controlled substance, but for short-term use under 5 days, it is actually safer than tramadol when you are on an antidepressant. And always tell every doctor every medication you are taking, including over-the-counter and supplements. 6th combination, diabetes medications and blood pressure medications. You are on metformin and glipizide for diabetes, lisinopril and amlodipine for blood pressure. 4 medications, all standard, all effective. Here is the problem. After 60, your kidneys are processing all 4 of these at reduced capacity. And when your blood pressure drops too low or your blood sugar drops too low, you do not feel it the same way a younger person does. Lisinopril and amlodipine both lower blood pressure by different mechanisms. When combined, they work well. But after 60, your blood vessels are stiffer. Your baroreceptors, the sensors that detect blood pressure changes, are less sensitive. You can be standing with a blood pressure of 85/50 and feel fine. Then you stand up. Your blood pressure drops further. You pass out. You fall. And because you are on aspirin for cardiovascular protection, you bleed more when you hit your head. Glipizide lowers blood sugar by forcing your pancreas to release insulin. After 60, your pancreas does not respond as predictably. Sometimes it releases too much. Your blood sugar drops to 45, but you do not feel shaky. You do not feel hungry. Those warning symptoms diminish with age. You just feel tired. You sit down, and you pass out. I operated on a 72-year-old man 2 years ago. Triple bypass, perfect recovery. He went home on metformin, glipizide, lisinopril, amlodipine, aspirin, and atorvastatin. 6 medications, all necessary. 3 weeks later, his wife found him unconscious in the garage. Blood sugar was 38. Blood pressure was 82/48. We stabilized him. But the fall fractured his C2 vertebra. He spent 8 weeks in a neck brace. The medications did not fail. The combination overwhelmed his aging system's ability to compensate. If you are on both diabetes and blood pressure medications, check your blood pressure at home twice a day, morning and evening. Write it down. If you're systolic, the top number drops below 100, call your doctor before your next dose. Check your blood sugar before every meal if you are on glipizide or glyburide. If it drops below 70, eat 15 grams of fast carbs immediately. Glucose tablets, half a banana, 4 ounces of juice, and carry glucose tablets everywhere. Let me tell you something I have never said in a lecture or a journal article. Every time I scrub in for surgery, I think about the medications my patient is taking. Not just the ones that affect anesthesia, all of them. Because I know that when they wake up, they are going home to a system that does not connect their cardiologist to their endocrinologist to their primary care doctor. I know they are going to take 6 pills from 6 bottles prescribed by 6 people who have never been in the same room together. And I know that statistically, half of them will have a drug interaction event within 2 years that could have been prevented. I have stood in operating rooms holding hearts that stopped because of medication combinations. I have stood in waiting rooms telling families that their father coded not from disease, but from the drugs meant to treat his disease. And the part that stays with me is how often the family says the same thing. But he did everything right. He took everything exactly as prescribed. That is the tragedy. They did do everything right. The system failed them. Your heart has been working for you every single minute of every single day since before you were born. It does not stop. It does not take a break. And after 60, it deserves your protection. Not just from disease, but from the medications meant to prevent disease. The patient I told you about at the beginning, the woman who coded at 247A, MD, her name was Margaret. She was 68. She survived. We adjusted her medications, eliminated 2, spread the others across different times of day. 6 months later, she came to a follow-up appointment and told me something I will never forget. She said, "I thought taking more medications meant better care. Nobody ever told me that after a certain point, they start working against each other." That question has stayed with me. When does more medication become too much medication? And the answer is different for everyone. But after 60, the answer changes. Your liver is slower. Your kidneys are working at 60%. Your body is processing everything differently. The combinations that were safe at 50 are not safe at 65. And nobody tells you when you cross that line. Here is what you need to do starting tonight. 1. Make a list of every medication you take. Prescription, over-the-counter, supplements, everything. Include the dose and the time you take it. 2. Take that list to your primary care doctor. Not your cardiologist, not your specialist, your primary care doctor. Ask them to review it specifically for interactions. 3. Ask if any medications can be reduced or stopped. After 60, sometimes less is more. 4. Never start a new medication without asking how it interacts with what you are already taking. Even antibiotics, even antacids. 5. Check your blood pressure at home. Check your blood sugar if you are diabetic. Know your numbers. 6. Carry a written list of your medications in your wallet. If you end up in an ER, that list could save your life. I want you to do something for me right now. In the comments, tell me how many prescription medications you are currently taking. Just the number. Because if you are taking 5 or more, you are statistically at high risk for an adverse event. And I want you to know that you are not alone. And I want you to know what to do about it. If this information changes how you manage your medications, share this video with someone over 60 who needs to hear it. Your mother, your father, your neighbor, because the medical system is not going to tell them. And the difference between knowing and not knowing is the difference between Margaret waking up in the ICU and Margaret not waking up at all. Subscribe to this channel because I am going to keep showing you what they do not teach in 7-minute appointments. The interactions, the side effects, the combinations, the truth about what happens inside your body after 60 when medications meet aging biology. It is never too late to take control of your health. But it starts with knowing what to control. And now you know. This information is based on my 32 years of surgical experience and current medical literature. It is not a substitute for personalized medical advice. Every person is different. Every situation is unique. Always consult your doctor before changing any medication. But go to that consultation informed. Go with questions. Go with your list. Because your doctor works for you, not the other way around. And your heart deserves a team that communicates, starting with you.